us. Let's give a couple of seconds for colleagues to join us. And hopefully they would have joined before we kick off the session. Once again, good morning, everybody. Good morning, welcome. Good morning, welcome. Ndawatsu inakwana ekaro tutuoma serido momarioke. Emesiri, bonjour and good morning from Abuja, Nigeria. And welcome to today's webinar. Today we will focus on improving safeguarding reporting amongst organizations in Nigeria. We will focus on improving documentation and reporting on sexual exploitation, abuse, and harassment. We will spend a significant proportion of our time to talk about the harmonized reporting scheme of the CHS Alliance. We'll also talk about the membership process of the CHS Alliance, amongst others. I am Sylvanus Nabena, currently serving as the Monitoring, Evaluation, and Learning Officer at the Safeguarding Resource and Support Hub Nigeria. I have over a decade of experience in supporting reform initiatives across federal and subnational levels in Nigeria. Welcome and bienvenue. Please be informed that we have available closed captioner. You can access the closed caption feature by clicking on the CC button at the bottom of your screen. So those of you that are currently engaging this session via your phone, the CC button is at the bottom. Your computers, the CC button is at the bottom. To deliver today's session, we have three seasoned speakers, representatives from the CHS Alliance and the Safeguarding Resource and Support Hub. Our first speaker, Oluchi Ihedero, is the national representative of the Safeguarding Resource and Support Hub Nigeria. She brings 11 years of dedicated experience in the aid sector and is a safeguarding expert. Oluchi has extensive experience supporting civil society organizations globally, providing expertise in capacity building and system strengthening. Oluchi's presentation will focus on the efforts of RSH Nigeria in improving safeguarding and the reporting. Our second speaker, Colin Rapno, has been the Protection from PSEAH Manager at the CHS Alliance. PSEAH, for some of us that are engaging PSEAH for the first time today, means sexual exploitation, abuse, and harassment. So Colin is the PSEAH Manager at the CHS Alliance. She co-leads at the CHS Alliance's she co-leads the CHS Alliance's harmonized reporting scheme that was launched in 2021. Colin began her career in 2004 in the International Criminal Tribunals for the former Yugoslavia and for Rwanda as legal assistant in the chambers, and then in the Defense Council before joining the International Committee of the Red Cross, ICRC, in 2007. She spent 13 years with ICRC, half of which in the field as protection delegates in Guinea, Democratic Republic of Congo, Haiti, and Cambodia, before taking up the position of sexual violence advisor at ICRC headquarters for almost 5 years. She holds a master's degree in international relations with a major in international law from the Graduate Institute of International and Development Studies, Geneva. Our third speaker, Matthew Burley, leads the Harmonized Reporting Scheme initiative at the CHS Alliance. Matthew has 10 years of experience working in diverse humanitarian settings as a protection, gender-based violence, and safeguarding expert. Matthew is the director of Closing the Gender Gap. Matthew speaks English, French, Spanish, and Italian fluently, and has worked with NGOs, She's worked with the UN, she's worked with research institutes across the world in Southern Europe, in South Asia, West and Central Africa, and Latin America. She holds a degree in international affairs, specialized in human rights from Sciences Po Paris. Mathilde and Colin will take us through the harmonized reporting scheme and the membership requirements for less resourced civil society organizations. Before we start, a few points on housekeeping. First, you are all on mute with your videos turned off. This is deliberate. It enables us maintain a certain level of quality and connection throughout the webinar. Please be aware that we will be recording this webinar to share on the online hub afterwards for anyone who may not be able to join. We're already recording anyways. And the idea behind it is so that if for those persons that join the session midway and those that are not able to join, they can always join and be part of it. Your names will not be visible. If you would like to ask any questions throughout the session, the Q&A session is live throughout. To engage the Q&A, just like we did with the CC, the Q&A, it's at the bottom of your phone, your computer, your device. You can add new questions or vote any existing questions. We will try to cluster them in order to answer as many of them as possible. If we're not able to answer any, we will try to respond to those offline and share with you. Please be advised that this webinar contains content on safeguarding that some persons may find distressing. If you would like to take some time off while the session is going on, do please take time away from your computer or your mobile device breaks. You can always join back when you feel a lot better. And if you want to engage the online hub to get the video, that's also okay. Your health is very important to all of us. At this point, it only makes sense to get into why we are all here. So permit me to invite our first speaker, Oluchi Ihedero, to kick off the conversation. Oluchi, please.
Thank you so much, Nabina. And thank you everyone for joining us today at this webinar. We are so happy to have you here. I am Oluchi Ihedero, and I'm going to be taking us through reporting, which is one of the key pillars of safeguarding, or PSEAH, as you may prefer to call that. And as Nabina rightly mentioned, PSEAH refers to prevention from sexual exploitation, abuse, and harassment. So I'm going to take us through the relevance of reporting, as well as take us through what contributions RSH has made so far in improving safeguarding reporting amongst organizations in Nigeria. Next slide, Sylvia. I will invite each and every one of us to look at your screen and have a quick reflection on this picture that you have displayed. And maybe make some notes to yourself, right? And leading us on that, let's start with the picture on the left. So we can see a group of individuals, right, whom their facial expressions has different messages. We can see some of them looking lost, some are confused, some are just indifferent. You know, they're just there. They don't even know what to do. Some are sad, unhappy. And when you take a look at their background, you see that it's more of catastrophic, showing that things are not moving well. Life is not so much, life is not so beautiful, it's not so well with them. And these people feel handicapped, right? They are not sure of what next to do. What action do we take? And this could be the situation of things in our organizations today, where the program participants and even our team members are unsure of what to do in the event of safeguarding violations, sexual exploitation, abuse, and harassment, not knowing who to reach out to, what action to take, how to get back their rights, how to get justice, and all of that. Now, moving forward with the arrow, we can see that the first arrow introduces different channels for reporting. So we'll have a complaint box, we'll have the call line, we'll have the focal person, that's safeguarding focal person, we'll have one-on-one method of reporting, and then we'll have the messaging. So these are possible channels amongst others that could help alleviate the situation of things for these individuals. Now, going forward, on the right, we have this same group of individuals now looking better, right? So having become empowered with the various reporting channels that they now have access to, they are able to, speak up, get their voices heard, send through the concerns or safeguarding issues that they may have been facing. And with that, looking at their faces, you see that it's now improved. They are happier, they feel empowered, they feel enlightened, they feel that they've gotten themselves back, they feel loved, and life around them becomes better. Now, this is just a picture showing us how effective and how strong the reporting mechanisms that organizations establish in their organizations can go or can be in combating against sexual exploitation, abuse, and harassment, or other safeguarding abuses and harms that the organization members and their program participants might be facing. Next slide. Now we'll move on to talk about what reporting actually means. So when we talk about reporting, what comes to mind? Now, reporting simply involves the ability of individuals or groups to send through their concerns, possibly about safeguarding or PSEAH, against incidents and other harms. This becomes more effective when clear reporting channels are created and maintained. So it's one thing to say you have reporting channels. It's another thing to say that your reporting channels are clear, that they are effective and efficient, and of course, serving the purpose for which it was created. So like the picture helped us to understand that it is important that we consider all of these relevant factors when setting up reports. And some of those points to consider is to ensure that the reporting channels are safe and confidential. Do people have the confidence of using your reporting channels? Do they feel safe? Or are the channels you set up or do they have the possibility of exposing them to further harm? Do they trust your process? Do they trust the system? All of these things matter. Then you should also ensure that they are accessible, that everybody amongst your program participants, amongst your stakeholders, amongst those who are supposed to use the reporting channels can access them irrespective of their disability system factors, irrespective of their literacy level, their socioeconomic factors that surround them, and gender and all of that. So you should ensure that the reporting channels you're establishing are accessible to the users. And that is why it is important that you consider the unique needs of the users and make sure that you have multiple channels so that if one does not meet their needs, they have that alternative opportunity to use the other. And then you promote the culture of reporting. Do people feel confident? So for little issues that were reported, how did you manage that? Do they believe that having managed the small issue, you'll be able to manage something huge and more serious, like sexual exploitation, abuse, and harassment? Are people aware of the system that you've put in place? We'll have scenarios where organizations set up reporting channels and people are not even aware. And when you conduct surveys, they tell you that they don't know that those things exist. So you need to raise the awareness, you need to promote speaking up, you need to get them to know their rights, know the acceptable and unacceptable behaviors to report and how to go about them. Next slide. Now, why is it important for us to have good reporting pathways? It ultimately promotes safer environment as well as quality programming. We are all conversant with the fact that reporting goes a long way in preventing sexual exploitation, abuse, and harassment, and other forms of harms in the organization. But amongst them is that, right, it helps the organization to create a safe environment where everyone is accountable, everyone is held responsible for whatever action that they carry out. Everyone knows that for whatever thing you do, you will be questioned, right? You'll be made to face the consequences. And so everyone is on their toes to ensure that your actions and activities do not pose harm to anyone or cause abuses of any form to anyone. And amongst all of these relevance, it is that it helps to prevent more harms. So when you are able as an organization to identify harms and address them promptly, then you've made some progress in preventing further harms from occurring because everyone is already conscious of the fact that you can't do this and go scot-free. And when your organization members or people involved in your system understand that your organization has zero tolerance to abuse and even zero tolerance to inaction, then they will be more confident to report abuses that they may not have carried out themselves, but may have heard of or may have experienced someone else go through because they believe in your system. And then that also empowers the concerned stakeholders, just as the infographic showed us. And it makes external reporting easier. Some of the organizations have different external persons that will report to. Some of us report to the funders, to the donors, to other partners, and maybe the harmonized reporting scheme that we are going to be introducing to you today from CHS Alliance. This is also one of the external reporting pathways that some organizations will go through. So it is important that you put your house in order, have the right systems to document concerns and collate reports to be able to send out accurate reports to the external persons. And with that, you have more insight into the system or into the situation of things in your organization. You'll be more confident to say, okay, my organization is free from sexual exploitation, abuse, and harassment, or my organization has some areas of improvement, or from the trend, we've been able to do well or not do well. And that can as well provide more insight into the prevalence rate of safeguarding concerns, both in your organization, in your community, in your context, as well as in the country as a whole, because we have a right system to collect this information, document, and then be able to share forward. Next slide, please. Now, let's look at RSH contribution in improving effective reporting in Nigeria. So one of the big things that RSH does is to ensure that organizations have support that they need, right, in improving their safeguarding systems. And we also big on ensuring that reporting mechanisms are put up in the organizations and that they are effective as possible. And the three major ways that we're doing this over the years is through development of relevant resources on reporting, hosting webinars, and providing mentorship support to the organizations. Next slide. Now I'm going to look at some of this information in details. And for the resources, it is important that we know that we have our online platform, which everyone can access on nigeria.safeguardingsupporthub.org. And there we'll have free resources on safeguarding reporting. One of them is how to design and manage community feedback mechanisms. And we have an animation video, which is about 9 minutes, that also helps organizations to learn further on these resources. So some people have learning needs that they learn better with visuals, right, or pictorials, and that is a way to meet that need. Next slide. So we have other resources. We have one on establishing disability inclusive reporting mechanisms, which I'm very happy about. This is one of our newest resources, which was just published yesterday, to ensure that organizations also factor in disability needs when setting up reporting mechanisms. And then we'll have a survey tool that helps organizations review their reporting mechanisms and be sure that they are working through. Next slide. So talking about the webinar, we've had webinars to promote. Next slide, please go ahead, Sylvia. We've held webinars in the past to promote these resources so that people are aware that they exist and how to access them on the platform. And then, again, we had the opportunity to welcome questions from the attendees and responded to them. And another effort of RSH is through the mentorship program. Next slide. In the past, we've conducted mentorship programs across two different angles. The first one is on safeguarding basics, and the second one was on organizational culture. And by mentorship program, this is a platform where RSH Nigeria provide handheld support to organizations over the period of 6 months to help them in strengthening their safeguarding systems and practices. And this we've done with particular attention on reporting, having realized the fact or established the fact that it is one of the key approaches towards preventing abuses and harms from being meted out to the organization members as well as the program participants. And we are big on guiding organizations to ensure that they make relevant considerations when setting up their reporting mechanism to be sure that they meet the needs of the users and that the reports of issues happening are not swept under the carpet, but are easily identified and responded to accordingly. And then the other one is on the organizational culture, which we did targeting the leadership of the organization. It is already established that for effective implementation of safeguarding in organizations, leadership has to own the process, right? They need to model the right behaviors and attitude that they want every other person to live by. They need to understand the importance of reporting and then provide relevant resources and support to the organization members, or maybe the safeguarding people person, or those involved in establishing the reporting mechanisms to be sure that they are well targeted and selected. And again, we had a podcast that we delivered in partnership with CHS Alliance, where we also revalidated the importance of organizational culture, the role of leadership, as well as how that is linked to effective reporting. And these, among other things, we've done so far and are still doing in supporting organizations towards improving reporting of safeguarding issues and PSEAH in Nigeria. Thank you so much for listening, and back to you, Nabina.
Thank you so much, Oluchi, for that insightful presentation on reporting and the existing resources to catalyze reporting and get the right culture. Welcome to those of us that are joining in, that joined after the kickoff, and welcome on board. At this point, I would like to highlight that the Q&A and chat functions are live. So feel free to start dropping your questions and comments at the bottom of your device. With that out of the way, permit me to pass the baton to Mathilde and Colin, who will take us on a journey to better understand the CHS Alliance's harmonized reporting scheme, as well as the membership process for less resourced organizations. Over to you, please.
Thank you, Nabina. So maybe next slide, please, and very quickly. So good morning, good afternoon, everyone. Very pleased to be here with you today. So maybe in a nutshell, what is the CHS Alliance and the Core Humanitarian Standard, the CHS? So for those who don't know, the CHS is a global network of approximately at the moment 215 international, national, and local NGOs, mostly. 50% are national NGOs from the developing and humanitarian sector. And we are all in this network committed to making aid work better for people in crisis. So the purpose is really to work towards more accountability and quality for affected people with support. So that's in a nutshell the CHS. So what's the benefits, I would say, to become a member? So first, to improve. So you get access to free or discounted, for example, training. You access guidance and tools for applying the core humanitarian standard, as well as technical support in various areas, including in PSEAH. It's my role to support our members. You will learn also from peers, so from others on best practices, and collaborate through what we call the community of practice. We organize webinars on a regular basis with our members. You will be able also to verify what does it mean. By using actually the core humanitarian standard, you can assess the performance of your organization. You see whether you have gaps or you have strengths, and if you have gaps, how to improve them, how to, I would say, how to fill these gaps. You get private access also to the CHS commitment tracker and dashboards, similar to what we will present you after on the harmonized reporting scheme, but here is on the core humanitarian standard. You can visualize your data and see where you are performing well or not. And you can, last but not least, influence. What does it mean? First, you are part of a huge global movement, huge global network to make work better for people we assist by applying the core humanitarian standard. And you can also obviously champion and advocate for a more accountable aid system. And we have amazing national and local organizations, part of our CHS membership, who are doing this proactive role of promoting, influencing, championing the CHS, and they get back in return, obviously, more visibility and some support from donors. So I know that the RSH team will share in the chat the links of the CHS website, if you can, if you want to have more information about how much it costs. So there are several prices, but less than $1 million for an organization is $100 per year. which is very reasonable to be part of CHS membership. They will also add the email address, membership@chsalliance.org, in case you want to have more information also about the membership. So that's about the CHS and the CHS Alliance. Next slide, please. Now, let's focus on the harmonized reporting scheme on sexual exploitation, abuse, and harassment. The reason why mostly we're here today. So what it is, for those who have never heard it before. So first, I would say it's a free, and that's important, and very user-friendly system. But system for what? First, and that's probably the main biggest objective, I would say, it's to enhance accountability and transparency. It's really key to tackle underreporting on PSEAH in the ed sector. So the more we're transparent, the more we're accountable, the less underreporting there will be. Second, it's a system that will allow you to collect and report in a very anonymous way. Nobody knows who report what, PSEAH incidents. So we have a variety of organizations, national, international, local, private sector organization, reporting the same set of PSEAH data in an anonymous way. For you and for organization, what does it mean? They are able to track their own trends and patterns in their context, in their own countries, in other countries where they are based, and they can compare with either trends from the same context but by other organization or from global trends worldwide. And these help really better understand the issue of sexual exploitation, abuse, and harassment globally, but also contextually, and better adjust, better focus their effort on risk mitigation, on prevention, or responsive efforts. So that's what is the scheme, I would say. Next slide, please. So now, what do we expect from the participant of the scheme? It's very easy, it's very simple. You report anonymous incidents in a platform that you have access to, which is free, which is available in 4 languages, French, English, Arabic, and Spanish. And you report either regularly, you fill out your incidents of PSEAH cases on a regular basis, or at the minimum every 6 months, because every 6 months we produce, Mathilde and I, an analytical report in which you find trends, patterns, recommendations, solutions, conclusions, etc. So your job is just, if you're a participant of this harmonization reporting scheme, is to report anonymously your data into a system. Next slide, please. And Mathilde, who will take the floor in a few seconds, will present you this new platform that we created with the support of IT providers, available, as I say, in 4 languages, which is very intuitive, very simple to use, takes only a few seconds, a few minutes to complete, for example, 1 incident. So here you have a picture of what you will get if you become a member, if you have access to the platform. It's the first page. And Mathilde, now I give you the floor.
Thank you, Colleen. So we're going to just show you a quick video about what is the harmonized scheme, so you can see what is the data that we collect, and then we'll show you a little bit about the trends that we can extract from that platform. So next slide, please. So we should have the video up here. Bear with us. It's always very brave to show video in a webinar because it's always very difficult. Thank you. Next slide, please. So as I said, so you've seen on the video a little bit what the platform looks like. We have the first part where you will report your incidents, and then the part on the trends. And as Colleen mentioned a little bit earlier, what we do as the CHS Alliance is that every 6 months we produce analytical reports where you can find the state of the information on SEH trends for the last 6 months. So I'm going to present to you some of our trends that came out from a year of data. Our new analytical report is going to come out next month, so you'll have updated trends soon. And these are based on data that were reported between October 2023 and September 2022 and September 2023, sorry, and based on more than 130 incidents. So you can see here the geographical location of the reported incidents. So on the map, the darker the color shade, the highest the number of reported incidents. And so during our pilot from which this data is taken out of, you can see that the most reported incidents were in Syria, DRC, and Iraq. However, what's really important for us is that this doesn't necessarily mean that they are the country with most SEH, but it's really useful data for us because we can use it to start triangulating with other data. So for example, we can compare with the SEA risk overview of the YASC, and we can say, well, we can see that Syria, DRC, South Sudan, Ukraine, OPT, a lot of countries are high risk in the index. Some of them we have reporting, but other we have no reporting. So if they have a really high risk level, probably it means that we may be facing underreporting. Or other differences are really useful. If we see, for example, that Afghanistan and Yemen are the highest in the SEA risk overview, but we have very little reporting, it means we may have a problem in those countries. So we have a lot of maps in our reports that we really encourage you to see, and the link to the full report will be shared in the chat. We're only sharing with you some small snapshots. Next slide, please. We also have information, as you can see, on the channels of reporting, which Lucy spoke about quite a bit earlier. So we look at how incidents are reported, so through which channels, and by who was the profile of the person who reported the incidents. So you can see on our screen that one thing that we saw is that at the moment complaints, community-based complaints mechanisms are used in few incidents, and that the vast majority of incidents are reported directly to staff. So really highlighting the importance of having these multiple channels, as was mentioned in the previous presentation. We also saw that 1 in 3 incidents was reported by a staff member who either witnessed an incident or heard the incidents from other community members, and that only 1 in 3 incidents are reported directly by victim survivors or their family. So this is really useful for us to understand how to adapt our reporting mechanisms. If CBCMs are not used very much, what is wrong with them? How can we adjust them? How can we improve them? Or if we have set up a network, for example, of PSEAH focal points, but here you can see that they were used in only 8% of incidents, then what's the reason? So it really gives us this entry point to say, how can we improve the systems for people to feel safe and confident in reporting incidents of SEH? Next slide, please. We also have, as you can see on this slide, an idea of the profiles of the victim survivors as well as the alleged perpetrators. So you can see for victim survivors that a vast majority are female, but also that 1 in 5 was a girl under 18. You can also see in the screen which type of incidents each gender and age group is most at risk of. For example, we are seeing recurrently that minors are much more at risk of sexual abuse, and we're seeing it in the new report that's coming out as well. So this is really valuable information to help us rethink our risk mitigation measures. So for example, do we need to adapt awareness raising sessions that we do in the community? Do we need to improve the response services? Do we need to re-examine reporting mechanisms, etc.? We also have information on the alleged perpetrator. We look at whether the perpetrator is an international staff or a national staff, because we know the power dynamics inherent to this. And one of the things that we see as well linked to power dynamics is that 1 in 4 alleged perpetrators of SEH are in a managerial position. And out of those, half are senior managers, which obviously is a huge proportion. And again, this really helps us say, okay, if a large part of perpetrators are managers, we need to rethink the way we work with managers. How can we change setting objectives, appraisal processes, so that SEH is central and we make sure that managers lead by example and don't contribute to incidents of SEH in the sector. So this is just a very small snapshot of the data that we have in the report. We really encourage you to read the full report because there is this information and some very concrete information on resources that are available so that you can really turn these trends into action. Next slide, please, and over to you, Colleen, to discuss how we can actually use these trends.
Yeah, thanks, Mathilde. I think you said most of it, but maybe these 4 little squares for you to see what you can do with the trends and the patterns from the biannual analytical report. So the first one on the left, you see it's to really identify the priority areas that you need or want to focus your efforts on. To better prevent, to better respond, to better mitigate the risk. So let's say, for example, Mathilde used, she showed like the channels in the previous report. So imagine that your only entry point for SEH incidents are community-based complaint mechanism. But in the report, you saw that it was only 5.8%, so 6% of incidents that are reported through CBCM. So here the trends really allows you to better understand that you need to readjust or refocus or redirect the resources to create new entry points or to assess new entry points. So it helps you redefine your strategy or your action plan. Then the second point is that these trends help you also request or focus your request to better resources, either internally to your leaders or to donors, by using solid evidence. Let's say if your strategy to tackle SEH in your project proposal needs solid evidence, here you have the evidence and you can present them to justify allocation of specific budget, let's say for training or to develop another reporting mechanism, etc. The third point is that you can produce with our report another report to publish on your website. You can use ours to publish on your website, and you know how important it is for transparency and also for donors who will be more willing to provide funds to organizations who are accountable and transparent. You can also use the reporting incidents to your donors using the same template we have, that will save you time and remove the burden that you might have by producing other reports for donors. Here you use what we're doing. It's quicker, it's easier, and you can dedicate time for other activities which are more meaningful. Last but not least, with the trends, you can also compare, as I said at the beginning, with other organization trends in your country or elsewhere. So let's say in one specific country, in your country, you have no incidents, but you see that in our report, in the same country, you have a very high number of incidents by other organizations. It means there might be a problem within your organization for reporting channel. So you might adjust and better target your activities to increase, for example, the reporting. So that's in a nutshell what you can do with the trends we produce. Next slide, please. So now what is the added value of joining? So as we said many times, the big one is a marker of accountability and transparency. That's the first big one. But then you, as an organization, what do you get out of it? First, you get a simplified SEH reporting. It's streamlined, it's harmonized, it's confidential. You get it for free. You don't need to do anything. We work for you. So it removes the reporting burden by using this platform and using the same set of SEH data. Second, you have access to aggregated data visuals on the scheme platform that Mathilde showed you through this little movie. You just need to use, for example, the filters or tailor your needs by context or region, but it's aggregated, it's already provided to you. Then you have access to biannual trends and analytical reports, as we mentioned, to better understand the issue. And last but not least, you're part, again, of a movement. Peer-to-peer learning, you can exchange, you can discuss challenges, and we provide also the HRS team some support, some mentoring to collect, to report SEH data, and to support you in reporting in the platform. Next slide, please, and we're almost done. Mathilde, your turn.
Thanks, Colleen. So you can see on the screen just the very simple process to join the HRS. So if your organization wants to be part of this movement, it's very easy. You contact us to tell us that you're interested. We will share with you a data sharing agreement, which is just a 2-page document that says how to use the platform and has considerations around data protection, which is very important for us. And once that's signed, we will provide you with an induction, the login credentials for the platform, and you will be set to start reporting and access all of the trends. So the email address to contact us is on the screen. So please don't hesitate to get in touch. We're happy to provide you more information, organize specific sessions with your leadership if you think that's useful. We're really much available to support you through this process. So that's it from our side. Back to you, Nabina. Thank you very much.
Thank you so much, Colleen. Thank you, Mathilde. Quite a comprehensive presentation. Thank you for taking us through the journey, letting us know even the membership requirements and what it entails, and then giving us a flavor of what the report provides. I would like to announce that RSH Nigeria will offer free This service was provided through our Ask an Expert service platform, and we should be able to share a link on the Ask an Expert service shortly. And it will provide, include 2-day technical support to organizations on their specified areas of safeguarding needs.
Apologies, Nabina.
So
Sorry, if I may, you froze for some seconds and we didn't get that announcement. If you could please repeat that. Thank you. Did you hear me?
Can you hear me now?
Yes.
Can you hear me now? I can.
Yes, we can. Go ahead, we can hear you.
Okay, great. So thanks, Oluchi, for the buzz as well. I was giving an announcement that RSH Nigeria will offer free safeguarding support services to the first 3 civil society organizations to register for this scheme, the Harmonized Reporting Scheme in the CHSI. And then this service that we will be providing would be through our Ask an Expert service and includes specified areas on safeguarding, the needs you have around safeguarding. Just wanted to share that. Thanks so much, Oluchi. Let's take a step back. We've heard from the panelists. Now let's hear from you. Are there clarifications that you would like to be made by any of the speakers? Do include, we are encouraged to unmute at any point so we can have a beautiful conversation. I can see that on the Q&A feature. So for those of us, the Q&A feature, just like I said earlier, it's at the bottom. I can see that questions have already been answered. So I have to come close to my computer so I can see the questions that have been answered and those that have not been answered. The questions that have been answered run. It says, hi there, please, what do you mean by cultural reporting? Oluchi has responded already that it's in this can include raising awareness on organizations, on
Nabina, are you still there? Sorry, everyone. I think Nabina is going through some network hitches and we've lost him. So I will just step in while we wait for him to jump back in. So Nabina was talking about some of the questions that we've received so far, and which I've responded to some of them. So the first one is around, what do you mean by cultural reporting? Oh, there you are. Nabina, do you want to please go ahead?
Yeah, so there are some responses on the chats, on the Q&A function. You've responded.
Okay, so maybe let me just continue. So for cultural reporting, there we talked about improving the culture of reporting, and as you can see in the chart, it can mean putting in the right systems for people to speak up and feel comfortable reporting issues or concerns that they may have. And ways of improving the culture of reporting could be raising awareness on your organization's safeguarding commitments. People should know what you stand for, letting them know their rights, understand what to report, whom to report to, how to report them, what would happen when the reports are sent through. These would help to build their confidence to report concerns, thereby improving the culture of reporting, amongst other things that can be done. Then the next question says, can local organizations be mentored? Yes, RSH Nigeria's, in fact, RSH Global's focus is on supporting local organizations, mostly less resourced organizations, right? And we usually publish an expression of interest for these organizations to indicate interest if they want to be part of our mentorship program. And from there, selections are made, and then organizations are selected for the mentorship program. We've already done that for this phase, and we have 7 organizations currently undergoing our mentorship program on safeguarding basis, as well as 5 other ones, 3 organizations and 2 safeguarding experts undergoing our mentorship program on safeguarding investigations. But that said, we also have other services available for other organizations who may not be part of the mentorship program. So we'll have the Ask an Expert service, which you can access through our website. Sylvia will put the link in the chat. And you can also send a mail to us if you're interested to benefit from the Ask an Expert service. Okay. Grateful if you could share all those links via email. So yes, that will be done. The 10 steps enumerated was not explained. Apologies for that, please. We were pressed for time to go into that, but the link has also been shared. Please look at the resource and the resource documents on that, and you will get more information on the 10 steps. Okay. And please, you can all look into the chat, the Q&A chat box for other responses that have been provided. There are lots of responses. We also have responses from our colleagues from CHS Alliance. So please, I implore everyone to check the Q&A section and get responses to the questions that have been answered, while we use the remaining time to look at other questions that have not been answered. And please send in more questions that you may have, even if we are not able to respond to them in this chat in the interest of time or in this webinar. We'll respond to them accordingly and publish them on our webpage where everyone can go back to and get responses to them. Thank you, and good to have you back, Nabina. Over to you.
Thanks so much, Oluchi, for stepping in. Thanks so much, colleagues in CHS Alliance, for providing the responses on the Q&A. So there's a question from Sharon. There's another question from Gloria. Sharon's asking, I'm interested in developing a safeguarding and reporting system for an organization who works with children through working with a local organization. This is proving difficult for a number of reasons. Does anyone have any example of this, i.e. working through another partner and or working with children? Thanks. So we can speak to that quickly. Who would like to take that? Oluchi, would you like to respond to that?
Okay, thank you, Nabina. I think I also responded through typing to that question.
Good.
And yes, I was saying that the resources we have that have already been dropped in the chat box would be helpful, could be helpful to a good extent in helping you respond to that need.
Okay, so
Colin
there
and
are other.
Mathilde can come in if they have other things to add to that, please, from your experience.
You mean about children, right? So that, for example, is typically something when you're a CHS member that you can benefit. I was approached, it's funny that you are talking about children, this question, because I was approached a few weeks ago by organization asking for good practices on child protection, reporting mechanism, investigation, how we include children in our prevention and response. And actually, I don't have all the answers. So what we do is that we are organizing, but it's exclusively for CHS members, on the 6th of June, so next week, community of practice webinar with different members who will come and share their good practices to those who are asking for it. So that's another example of what the membership could be useful for. It's when you're facing a challenge, you can ask for peers to support you. And the CHS membership is there for that. Yeah. But I cannot answer like that about the question, unfortunately.
Thank you so much, Colleen, for that perspective, and that's quite helpful still. There's a question from Gloria Okoye. She asks, how do you address errors and data inaccuracies when the reporting system is not integrated with the planning system? Is that something that you would like to look at, Colleen, Mathilde?
Actually, we ask for more details about what means planning system, because we're not sure with Mathilde about the question. So if Gloria can just specify what she means by planning system, it would be easier for us to answer.
Okay, thank you. Gloria, by all means, you can update the question. Whatever we're unable to ask or respond to, we can always respond offline and communicate with you. There's a comment from Hawa says, can donor organizations also join the platform, development partners not funded by UK aid? Mathilde, Colin, would you like to speak to that, or have you already?
Yes, I think the answer we answered in the chat, but of course, any organization, regardless of who they are funded by, can join the harmonized reporting scheme for free. So there's no limit with regards to who's your donor. We are working with the majority of donors to align, but it's not conditioning you joining the harmonized reporting scheme.
So I can see on the chat as well that comment is linked to a question asked by Udwa Kudofia around discounts and membership discounts, where you did speak to how much it costs per year and links to the budget. So that's quite helpful. I'm mindful of time. So any organization, the last question I can see here, so any organization can use this platform for their internal reporting mechanisms. Can we include more languages? Thanks. This is from Gunjana Kunwa. Mathilde, Colin?
So yes, we answered the part, and obviously every organization, as we said, can join this platform. Once you join the harmonized reporting scheme, we give you the credentials and you have full access to the platform, the trends, etc. As of now, as Colleen said, it's only available in English, French, Spanish, and Arabic. We will try on the longer term to get it into other languages. So the French, Arabic, and Spanish one has just gone live. And obviously it requires additional budget to have other languages. So it's something that we keep advocating for, and we hope to achieve later down the line. And obviously we will keep you posted through RSH when this does happen.
Thank you so much, Mathilde. We will come back to some of these questions, but just want to appreciate all of you, appreciate the panelists, appreciate yourselves for putting out questions quite rich, and still the fact that you're still putting out questions, that's very, very encouraging. We will be sharing a short poll with you now. We hope to use the findings to inform the kind of services we provide to ensure that we constantly improve our service. Details about relevant resources and services Yes, the poll should be on your screen now. And for those of us using our mobile, you should be able to access the polls from the bottom as well, if you can't see it up in your screen. Details about relevant resources and services of RSH, such as the Ask an Expert service for networks and groups, and the website link to the e-learning modules will be shared on the chat, should have been shared now. You can also be shared to everyone that registered for the webinar, so we're all beneficiaries. We'll be sharing this webinar recording and slides with you shortly, as well as other related resources if you want to hear about future RSH webinars. Of course, subscribing is a good one. The links, like I did hint, are in the chat. Looking at the time, we still have a couple of minutes. We should be able to respond to more questions and get some time to hear final words from distinguished panelists. There is a question from Gloria. Gloria says, by planning system, I mean flow of information within an organization. So this was a quick query that was asked. Mathilde Collin, linked to our earlier point about what was the comments about inaccuracies?
So, I mean, I'm not sure I understand. I mean, because obviously the flow of information within an organization is very specific to the organization. It's going to differ from one organization to another. But please do write to us and we can support you to see how we can make it fit. So as Colleen said, we do provide mentoring, so we can really look at the process within your organization, how the information flows, what is the reporting process, and we can help you build this, include the harmonized reporting scheme into this process so that the incidents get reported onto the platform. So please don't hesitate to reach out if you want us to support you to set this up in your organization.
So there's a question from Tankard that has been responded already by Colleen. Tankard had asked about how can a local NGO access the tiers of investigations, and the responses have been provided around tier 1 and tier 2 being free for local NGOs. That's quite helpful. I'm looking at the time, and I am very, very appreciative of the comments. Please keep the comments coming, keep the questions coming. Are there any final words that colleagues, the panel members would like to share? Oluchi, is there any point you would like to share before I pass the baton to Colleen and Mathilde?
Thank you so much, Nabina. If I may pass my slot to Ziba Abunejaila, the PSEAH coordinator in Nigeria, to quickly say something in just a minute, if you don't mind.
Good afternoon, everyone. I'm happy to see you. I just wanted to thank you for all your efforts, both Safeguarding Hub and the CHS Alliance. This is not the first webinar. It's the first webinar by the Safeguarding Resources Hub, but there was another webinar with the PSEAH network from both of you. So I'm actually encouraging everybody to join the CHS Alliance, and I hope if there is any questions, they actually also can reach out to the PSEAH network. The webinar has been forwarded to the network members, so I can see from the questions there are some of them in the participants. So thank you again for the amazing work, and work with you closely. Thank you.
Thank you so much,
Diba. Over to you, Nabina.
Thank you, Diba. Thank you so much. Colleen, Mathilde, any final words?
Just thank you very much for having us. Please don't hesitate to contact us if you have further questions and if you're interested in joining. And we hope that a lot of people in this group will be reaching out soon. Thank you a lot.
Yeah, on my side, I see still a few questions. Please look out at the links we share with you. You will have all the answers about the fees, about like collaboration, etc., etc. And for the first question, when the person say, please answer the question about the head of an organization, etc., etc., I guess you can reach out to Oluchi, who is also working on this question, as it's more related to RSH, I think, and the support they can provide. So thank you very much. And yeah, as Mathilde said, please feel free to reach out to us for the harmonization reporting scheme or the membership at chsalliance.org for everything related to CHS.
Thank you so much, Colleen. Thank you so much, Diba. Thank you, Mathilde. Thank you, Oluchi. Thank you, distinguished ladies and gentlemen, for sparing this 1 hour and being with us. We hope to engage with you in the coming days, like colleagues have said. We hope to have future engagement, and hopefully we can improve reporting as a community. Do enjoy the rest of your day. See you soon. All of us, see you soon. Bye.